Dr. Davis, we've talked about liposuction and how actually the new equipment, which somehow has to do with liquid, with water, and anyway, it gets fat out easier, better, faster, and with less downtime on the patient, and very, very importantly, it can actually be reused in the body to basically skin tighten or do certain things in other body areas. Tell me, where, which body parts respond well for liposuction? Where can we get off the, that extra little inch?
You can use it. You can use it from the chin down. Anywhere from the chin down.
Okay, so what do people use it a lot for? What is some of the most common uses, and what are the effects after you have done it? Well, why on the chin? Like, are you talking about getting rid of the double chin? Because I'm enrolling. If that's the truth, enroll.
If your double chin is due to fat, yes, sir.
Okay, you mean it's not always due to fat? I can actually tell my wife
not
that.
Always.
Oh, really? All right. So, for instance, on a double chin, does it really get rid of a double chin, or does it kind of, drastically diminish it, or what are we talking about?
It will get rid of the double chin if it's due to fat. The thing with liposuction is that once you take the fat out, it's absolutely gone and will never ever come back. So if you gain weight again, the weight will go to somewhere else in your body, but will never ever go back to where we took the fat out because the fat cells are gone. When you lose weight, the fat cells shrink, and you can gain it back again. But when we do liposuction and take the fat out and throw it into the garbage can, it's gone, and you can never ever gain weight back into those fat cells ever again. It's permanently gone.
Well, that's interesting. I never heard about that. So basically, if you get rid of the love handles around the, hips or whatever it may be, then you mean then even if you continue doing, because you have them because of a lifestyle, you eat too much, basically. You eat too much, you exercise not enough, whatever it may be, a combination of it. So you're telling me, because most of us will not change our lifestyle after doing the liposuction, you're telling me that it then won't come back anymore.
Not into that area. No, it's gone. That fat is in the garbage and it's gone. Because if you lose weight, you shrink the cells, but you can gain it back again and they'll re-expand. But if I throw the fat in the garbage, it's absolutely gone.
How interesting. Now that is worthwhile knowing for people, especially, we live in a world of instant gratitude. I mean, it doesn't get more instant as that, and then kind of it not, because normally, well, like with losing weight, losing is one thing. Staying that, that takes whatever, a few months, whatever it may take, but then living like that, disciplined the rest of the life is a different thing. So you're saying, those small discretion, they will not come back. Unbelievable.
That's right.
Tell me, but, liposuction is not really for losing weight. It's for getting rid of areas which are a little fluffy, a little...
Problem areas.
Problem areas. Yeah. So, a guy or girl with a little belly, with, where things sit very fast for most, at least for guys, and go, can it help there too, or not?
Sure. It can help anywhere where you have fat. For example, I did a young lady last Friday who you would look at and say, well, she's so tiny, she's beautiful, she doesn't need anything. We still got a half a liter of fat out of her, and 4 days later, she looked like a beauty queen. We still got a half a liter of fat out of her.
So a guy
nobody to look at her would have ever known she needed it, but we still got a half a liter of pure fat is a lot of fat.
Right. So a guy with a belly and having 2 or 3 inches too many for sure, maybe more. But anyway, let's just, let's stay within reason. Let's not talk about the 300-pound type of people. But, a guy has like at least...
Well, I wouldn't do a 300-pound person. I like to keep the body mass index. I like to do it... Excuse me a second. Sorry about that.
That's all right. Happens to the best of us.
I like to do it with people who have body height to weight ratios around 30 or less, because those I can really contour. As you said, it's not for weight loss. It's for body contouring. We can easily get 2 liters of fat out of people who have body mass indexes around 30, who have problem areas where they collect it in their belly, or in the love handles. Or a lady came to me and said, I have 2 butts, where what she meant was she was collecting in the thighs, and they were big, huge rounds on the outside of the thighs, and it looked like she says, I have 2 butts. This is the way she described it. So, people describe things in different ways, but that you can completely take care of and make them look normal and make them actually look really nice.
Great. Now let me ask you, when you take out fat, don't you still have the skin, and now you get wrinkled skin?
It depends, and that you don't know until after you've done it. Most of the time, because we're contouring and we're taking this fat underneath the superficial skin, it will tighten. It will tighten over time as this edema goes down. Sometimes we do have to deal with the skin later, but we don't know until after all of the swelling has gone down, and that actually takes a period of over 4 months to
tighten the skin again.
Yes, there are methods we have to tighten the skin if we need to.
Okay, all right. Well, wonderful. Absolutely astounding that the fat doesn't come back. That's incredible. Dr. Marsha, thanks a lot.